Welcome to my super type A attempt at being Zen, the podcast. My name is Risha York, and I will be your host. If you are overworked, overtired, overstretched, overwhelmed, and just over it, you are in the right place. We like to say we are currently working towards Zen-ish. I'm thrilled that you've joined us. Let's see who will be supporting us on our path to Zen today. Welcome back to my super type A attempt at being Zen. My guest today is Jennifer Burgmann, and Jennifer and I were just saying that we've known each other a long time. Like longer than you think you should know people, like over 20 years for sure. I'm going to give her a chance to introduce herself here, but welcome, Jennifer. Thanks for coming.
Hi. Oh, it's my pleasure to be here. And yeah, 20 years has been a really long time.
Where does
And you
that time
look
go?
great. You look fantastic.
Oh, you do too. I was saying all the colors you're wearing are just lightening up my entire day.
Yeah, this is my sassy spring outfit.
I love it.
Yeah.
I'm here for it.
My name is Jennifer Burgmann, and I currently am involved in theater. After my illness, I was sick. I got really sick over a decade ago, and I was completely out of the theater industry. And when I sort of reintegrated back into the community, I didn't think I belonged anymore in the theater community because my body was no longer the same body. I use a power wheelchair now, and I live with chronic pain, and so I thought I don't belong. But then a couple of years ago, I saw an ad on Facebook for Real Wheels Acting Academy, and it was a program, an acting program designed specifically for disabled people. And at first I was like, what is this? Is this going to be like a glorified day camp for disabled people with a theater theme kind of thing?
Right.
But I thought this would be a really good opportunity for me to get back in there and see if I can do it. And it's been fantastic. It has opened up so many doors for me. I've made contacts and I've been involved in shows, and I've had the opportunity to pursue directing, which is one of my passions, and writing. I'm writing a play now. I used to be a prose writer for a long time. So I discovered that, yeah, I absolutely do still belong in the theater community, and I have a lot to offer, and just really, really enjoying my life right now, which to me is it's a bit of a surprise because 10 years ago I was suicidal. I didn't want to live after my illness. So the immense change in
Right.
my life and my attitude and my perspective has just been fantastic.
That's incredible. Well, so tell us a bit about that. Like, tell us about your healthcare journey, because I feel like there's so many of us who have been through the ringer when it comes to like surprise illnesses or surprise issues. And like, you sort of touched on, you were suicidal at some point and now you're surprised that you're in this good headspace, right? What's part of that resilience? Like, tell us a bit about that healthcare journey, and then let's talk maybe a bit more about that journey back to you.
Back in 2009, I graduated from SFU with a theater degree in 2004. And in 2009, late 2009, I was I was an alcoholic at the time, and I had decided to quit drinking. And so I went to the, mental health and addiction center, and I got involved with a therapist and a drug and alcohol counselor and a doctor that specialized in addictions. And while I was at seeing the doctor, the medical doctor, she had recommended that I take a number of these vaccines because my immune system was, in poor shape. My husband had hepatitis C at the time. So the doctor recommended that I take the hepatitis A and B shots.
Hmm.
And also it was flu season, and that was the time that H1N1
Oh,
was
okay.
happening. So
Yep.
they had created a dual vaccine, a combination of the seasonal flu and the H1N1 flu. So I had a couple of vaccines 1 week. I came back a week later and had a couple of more. 2 weeks later, I started getting these symptoms, really strange symptoms. I thought they might be related to alcohol withdrawal, except that, if you're going to get those kind of symptoms, it's usually within the first week.
Yep.
And I was sober by then by about 3 or 4 weeks. But I was experiencing dizziness and weakness. I was dropping things. I was getting, blurry and double vision. And I went to the Surrey Memorial Hospital a number of times. My husband took me a number of times, about 7 times in a couple of weeks. And each time they sent me home. The tests didn't show anything. I was gaslit, of course, because I had, mental health in my chart,
Yep.
issues in my chart. They assumed it was mental health issues. Eventually I went to I had an appointment with the doctor set up. So I went back to the doctor that I had been seeing before, and she immediately sent me to a neurologist at RCH, immediately saw that it was neurological. And he sent me to a neuro ophthalmologist because my eyes were, I had ophthalmoplegia, it's called, with when one eye is paralyzed. So my eyes were looking in different directions. I had double vision. I couldn't see. And at that point, I was starting to have trouble swallowing. I couldn't even swallow my own saliva. My throat was so weak.
Right.
Well, I was admitted to the ER right away, and they did a whole slew of tests. None of them would show any, there was clearly something was going on,
Yeah.
but they couldn't figure it out. And eventually the neurologist I was seeing made an educated diagnosis of Bickerstaff brainstem encephalitis. It's a mouthful. If you've ever heard of Guillain-Barré syndrome,
Hmm.
GBS, or Miller-Fisher's syndrome, it's a variant of that,
Okay.
but it was quite severe.
Right.
And they tried to treat me with IVIG, but it was too late by then. And one night I just, my vocal cords finally became completely paralyzed, which cut off the air, which caused, an attack, a cardiopulmonary.
Yeah.
So they ended up having to put me in a medically induced coma because they had to intubate. And I was in that coma for about 6 weeks, and I almost died a few times, apparently.
Yeah.
And then when I came out of the coma, I was paralyzed for a period of time. I was really out of it at that time. I had a lot of medication on board. I was in and out of consciousness.
Yeah.
Don't remember a lot, but I did obviously eventually recover, but it took me 18 months. I was in RCH for 18 months.
Wow.
That was a long and
That's a
mostly
long time
bed
to be in a
confined.
hospital.
Yeah. And it was super. I mean, I had family and friends coming and visiting and that sort of
Yep.
thing, but they can't be there 24/7.
No, of course
And
not. So that's going to be lonely.
yes, and as time goes by, like after a year, the rest of the world goes on. Like
Yeah.
people have lives, they have to go back to work, so I was getting less and less visitors.
Yeah.
So yeah, it was really, really hard, very painful, physically painful, mentally painful
Yeah.
time. And then I went into rehab for a couple of years. I went to GF Strong, then a group rehab home, and eventually moved into independent living,
Right.
which I've been living in for about 10 years now.
Right.
Yeah. So that's the sort of the basics of my journey. But man, there's all the things that happened in that time,
Oh, yeah. It's like
super
hurt
traumatic.
and hurdle after hurdle after hurdle. And it's like you have to pick yourself up from your bootstraps every single time and start all over from a place you're not familiar with.
Yeah.
Right?
Yeah. And after, it's funny because when you come out of it's not like in the movies, when you come out of in the movies, people come out of comas and they're talking and chatting with friends and eating in the hospital bed, and then they're out walking the streets a week later.
Yeah.
Not a hope. Like
Yeah.
I celebrated the first time I was able to sit on the edge of the bed for 10 seconds.
Yes.
Like the muscles in your body
Oh,
just
yeah.
they atrophy so quickly.
Yeah, it's incredible. So I was telling you, I had a double pulmonary embolism when I was 24 and I was hospitalized. I was only in the hospital for 2 weeks. However, that was highly mismanaged too. So I went into the ER and they were like, nothing's wrong, send her home. And I got back home. And luckily, I was staying with my parents. I can't imagine like what would have happened if I wasn't. And I couldn't breathe. And it was almost like I was having contractions, but for what reason? And I couldn't breathe. I was like gasping for air. So they brought me back. And I have to thank Dr. Stefanison for that. One of my elementary school best friends, his dad's a general surgeon. My mother called him and was like, "This is what's going on." He was like, go back now. Like she needs to be at the hospital now. So I got there and they were like, "Oh yeah, we don't." And I was like, "Dr. Stefanison said to come back." And they were like, "Oh." And they took it very seriously all of a sudden, but they didn't believe me when I was saying all the things that were going on with me. And all of the symptoms were there too. Like I couldn't lay flat on my back. I felt like I was drowning and they were like, "Oh, it's fine." I did say that I had a history of using marijuana, and so they immediately thought I was trying to get drugs out of them for back pain. And I was like, no, listen, I can't breathe. Right. And they finally brought a doctor in who said, far, far outside chance she has a pulmonary embolism. It could be appendix or something. And then they got me in, they did ultrasounds and all this jazz. And they found that in both lungs, I had um, blood clots. So I wasn't able to breathe. I was, was drowning from the inside
Oh
out.
my
Right.
goodness.
Terrifying. And so then they prescribed a medication, which the nurses never gave me, that were supposed to help me recover quickly. So I was in there for 2 weeks, crying in pain. I also can't use most of the good drugs, like the things that people go to try and scam people out of don't work for me. So they're giving me morphine and it's not working. And she's like, "Well, we have you on enough." And I'm like crying in pain. They had to quadruple my morphine input for me to even feel it. And I was just a mess. It was a mess. But like you said, like I was only there for 2 weeks. Near the end of the 2 weeks, I was trying to get up and maybe like do a lap around my room. But I remember once I got home, they were like, "You're basically on bed rest for the next 6 months." And I was like, What?" And they're like, "Yeah, you're gonna have to retrain your lungs to properly like breathe." And I think like by a month, I could get to the end of the driveway at my parents' house and then back in the house.
Yeah.
Right? Like it's a huge undertaking to recover when your body's been through that level of trauma.
Yeah. And so frustrating
Yes.
because when you're accustomed to your body operating the way you expect it to, and all of a sudden it doesn't, it's just so frustrating.
Yeah. And especially if you're, and I mean, correct me if I'm wrong, Jen, but you have always been hyper independent person, like as long as I have known you.
Yeah,
So that's
yeah,
frustrating too, because asking people for help and to do things for you is infuriating when you're hyper independent,
yes, yeah.
right?
That was my greatest obstacle when I was going through rehab, but also in the hospital, like laying in that hospital bed and not, because my shoulders were contractured, so I don't have much range of motion. My
Yeah.
feet were pointer flex, so I couldn't stand up. My body was just recovering from a coma, so laying in a hospital bed and not being able to do anything for myself, literally
Yeah.
like an infant,
Yeah.
was just so demoralizing
Yeah.
and frustrating and, yeah, just depressing.
Yeah, I
Uh,
totally relate to that. And I mean, I also watched my mother, she had Parkinson's, go through the same thing. Like, I remember one Christmas, I had decided that we would have Christmas at their house just to make it easy for her because she couldn't really get around. And I was like, I'll make turkey. And I'm in the middle of doing it, and she's laying on the couch and she's like, no, no, listen, this is what you're going to want to do. And I remember turning around at one point and being like, listen, I bet it's really fucking frustrating not to be able to do this yourself because this is your domain. This is your space. This is what you're about. But like, I'm a grown adult and I know how to make a turkey. So just let me make the turkey. Okay. And everyone left the room out of like, I don't want to get in the middle of a fight with these two. Right. But it was funny because she actually laughed it off and she was like, yes, that's exactly it. Like, I'm used to being in control of things. I'm used to having control and being able to do what I want to do. And at this point in time, I don't have that control anymore. And letting other people do things that I should be able to or I want to be able to do is just gut wrenching to
yeah,
watch, especially when I think you're doing it wrong. And I was like,
yes.
thanks, mom. Uh, right. But yeah, like that sums up the feeling, if you can't do the things that you took for granted, really.
Yeah, yeah. And the other part of it too is that because of the condition my body is in now, I require help to dress and to bathe and that sort of thing because I can't, wash my own hair. And so, and that was all, I mean, that's been for the last like 13, 14 years,
Yep.
always needing help. And that takes a lot of getting used to,
Yeah.
especially, with people touching you all the time. Like, I remember just getting so sick of being handled by
Yeah.
other people, but it had to be done.
Yeah.
And um and that feeling of helplessness, as like literally feeling like an infant as people are, rolling me in bed and washing me and dressing me and that sort of thing. And even now, I have a lot more independence, and of course my caregiver is very respectful and we have a comfortable relationship. But yeah, I that's one of the things I live with, is
Yeah.
having other people touch me and my body on a regular basis
Yeah.
because it needs to be done. And there are days where I'm just like, fuck off.
Oh, of
Like, I
course.
just leave me alone. I don't want anybody touching me, but it has to be done because I have to get dressed, get ready for the day and go.
Yeah.
So yeah, there's
Yeah.
that. Now I'm fine with it. Now it's part of my routine. And I've been with my caregiver for 10 years. So
Yeah.
it's not uncomfortable. But boy, I'll tell you, there are times where, like, she goes on vacation, so she'll need to bring somebody in.
Yeah.
And if it's somebody I've never met before, there's that whole getting used to a stranger seeing me naked, touching my body to,
Yeah.
help me dress.
I mean, I feel like theater school kind of prepares you for people seeing you naked,
Yeah.
but
Yeah. Yeah, I was probably a lot less humble about it than most people. I was like, I go for it.
I joked about that a lot when I had two kids and both were C-sections and required surgery. And the first one was an emergency C-section. So it was like, guess what? This is happening. And then I actually right after had an allergic reaction to the glue they have on surgery tape. And so it was like third-degree burns all over my stomach
Oh
where they used
no.
it. It was awful. So when I was getting into the shower for the first time afterwards, there's like people coming in and out. And someone had mentioned, like, oh God, you have no privacy. And I was like, that's fine. I went to theater school. We regularly are nude in front of each other. It was sort of kind of part of the thing, like 18 people in one change room. It is what it is. I don't really have a lot of modesty around that. I'm not that concerned. I'm like, I'm well trained. It's fine. But like we joke, but it's true, right? Like you get more used to being like, sure, whatever. But the touching thing is a whole other ballgame.
Yeah. Yeah. Well, I mean, your body is sort of the symbol of your personal autonomy and
Yeah.
independence. And it's your domain. You have a right to decide who can touch it and who can't.
Yeah.
But when you're in that situation, you don't really have that right anymore. It's just taken from you because things have to be done. The
Yeah.
patient needs to be clean. They need to be dressed. They need
Yeah.
to, get whisked away for this test or that test.
And I mean,
And
is that sense too of like not having control over that. I don't know how you felt about it, especially early on, but for me, anytime that's happened, it's like I almost go into a panic where it's like, what's happened? Who's touching me? What's going on? And I can't rectify it. Like it takes a minute for my brain to catch up with what's actually happening.
yeah,
Does that
yeah,
make sense to you?
yeah. And I think it's particularly in a hospital setting where
Yes.
people are overworked, nurses and care aides and everybody, they're overworked. Um, some of them, in my time, I always say about 75% of the nurses and medical professionals were just regular, average, decent, going about their job.
Yep.
There was a handful of them that were really spectacular
Yeah, like above
and
and beyond.
yeah, and great bedside manner and always making me feel comfortable and seeing to my needs and stuff. Then there was a handful of them that were outright abusive and
Yeah.
cruel. And when you're in that sort of institutional, sterilized situation where these people are just doing their jobs, I felt like I felt more like an object than I did
Yes.
a human being.
Yep.
And quite often the care aides, they'd come in as a team and they'd be washing my body and cleaning between my legs and all this sort of stuff and just chatting away about their day
Yeah.
as if I didn't exist, as if I was just more like a sack of meat that they had to take care of
Yep.
while they're going about their day. And that's I don't even know how to describe that feeling. It's horribly humiliating
Yes.
and it's like an erasure of me as a
Yes.
as a
Yeah.
viable entity on this planet.
Yes.
Yeah.
Yeah, I've had a similar experience when I was under for a sinus surgery I had, and it was very similar. They were talking over me, and I'm like, I'm right here. And my mother would talk about it a lot, especially as she got older. She said that people would talk, especially because she had a visible disability, especially nearing the end. Um, People would talk over her like she didn't exist in the room. And my mother was a very strong woman. So she would be like, hi, I'm right fucking here. And like she would just
Good for
call them
her.
out on it, which I was like, good for you. Yes, that's what you should do then. Um, but she would complain about it, how infuriating it was. And I think about that a lot too, because I think, we have a tendency, unfortunately, when we're in jobs like that, to ignore the human aspect when we're a little too far jaded,
Yeah.
right?
Yeah.
And I think your testimony essentially is exactly what everyone needs to hear. It's like there's so much humanity involved in what we all do on a regular basis, and kind of denying that humanity, right? And the fact
Yeah.
that you're right there participating in this conversation, whether they know it or not,
Yeah.
you know?
Yeah. I remember when I was in the coma, I don't remember a lot. It was mostly blackness, but there were moments where I do remember. There was one moment where I remember my mother singing to me Blue Canadian Rockies. There's another moment, a couple of moments where I remember my aunt reading The Cricket in Times Square to
Oh,
me.
that's cool.
And there is one awful moment that I remember. I just remember sort of the fog parting, and there's two doctors standing over me, and they're talking, but I can't really hear what they're saying. But the last thing I hear before I sort of fade back is she's circling the drain.
Oh, Christ.
One of the doctors said she's circling the drain. And so, of course, I may be in a coma, but my
Yeah, like I'm
brain
right
knows
here.
what that means. Yeah.
Yeah.
So, yeah, that's a lesson for you doctors, man.
Yeah,
When you're
no
talking about
kidding.
an unconscious patient, they might hear you. So,
Yeah,
be careful about
absolutely.
the things you say.
Absolutely. And I mean, I think that's something, to also come back from that to a place where you can rebound. And I mean, geez, I'd be marching into that guy's office.
Well, the problem is when I was in that state, I was completely vulnerable and helpless. Like
Yeah.
I wouldn't be able to speak out or advocate for myself in
No,
that
of course not.
situation.
Someone would have to do that for you.
Yeah, so if nobody was there to see it, or so, like in the cases where there was abuse, there was one nurse that was absolutely horrible. Um, if it was, and she worked the night shift, so if it was late at night and something happened, if I was, under a lot of medication, I might not, have the capability to report it. Or there have been times where I have reported it, but it didn't get through because sometimes, nurses
Gets
protect one
handled.
another. Yeah, so
That sucks.
yeah,
Yeah.
you really are, as a patient in a hospital, you really are vulnerable and at the mercy of the sort of the powers that be.
Yeah, so I
So
mean, I've had a very similar experience several times over. And I mean, I guess that's my next question for you is when you're going through this healthcare system, when you're, journeying through it for now over a decade, what have been the biggest challenges?
well, the biggest challenges since leaving the hospital, since sort of integrating back into the community and becoming independent again, um, one of the biggest challenges is the power wheelchair. Not for, I love my chair. It provides me with independence, autonomy. I can go places in it. I'm not stuck at home.
Yep.
Without my chair, I'm really lost. These are my legs.
Yep.
However, navigating the world in a power wheelchair can be very challenging.
Yep.
Fortunately, we have a lot of technology now, so we have elevators and kneeling buses and all that sort of stuff. But when those things aren't working, like
Mm,
if I get to the SkyTrain and the elevator isn't working, that's a real pain in the ass. I can't just run up the elevator up the stairs. I now have to get on another train to get to another stop, and
yep.
so the power wheelchair is sort of the biggest challenge in the world.
Yep.
And I would have said that, in the beginning, my greatest challenge was physical disability. My body no longer works anywhere near the way it worked before. So I have to adapt. And when I do that, like in my acting, performing and that sort of thing, I have to adapt my body.
Mhm.
Out in the world, I have to adapt, how to tap my card at the SkyTrain station, for example, because only my left hand is capable of doing that. So I have to turn my chair around and tap with my left and then enter the station. So in the beginning, the disability part of myself was the hardest part. Now, a decade later, it's not so much that anymore, because I've learned to adapt and operate in the world with the body that I have now.
Yeah.
So I mean, I think that's natural and normal for human beings to struggle
Yeah.
in the beginning, and then learn to adapt, and then it just becomes a part of life. So now it's funny when I get strangers sort of looking at me with pity, or making comments that are sort of like, "Oh, poor you." I have to laugh, because I'm like, I don't feel that way anymore. Like,
Yeah.
I is who I is, and I'm
Yeah.
doing pretty good in the world.
Yeah.
And, it happens to be in this body with this chair, but still doing great.
Yeah,
Yeah.
absolutely. And what challenges have you run into like with the healthcare system as you've been going along? Like I know at first you were saying there was a lot of gaslighting and like not understanding where you're coming from. And, I certainly have also experienced oh, you've smoked marijuana or you've done that. Oh, so you're just here for drugs, right? And it's like, no, that's not what's going on here. So have you run into and challenges around medications,
Mhm.
especially since I'm sure there's a trust issue there after after the vaccines. What kind of challenges have you run into with the healthcare system?
Well, of course, at the beginning, I ran into um, a lot of gaslighting, and just sort of general dismissal. Like, if there wasn't an answer that came from the standard tests, they weren't willing to push further.
Yeah.
And using my mental health issues against me, and making assumptions that, about, um that they said things like, "Oh, maybe you're using the computer too much, and that's causing your eyesight problems." And so the gaslighting was a big problem, and
Yeah.
just sort of the dismissal, and just the laziness in wanting to find answers,
Hmm.
especially with the fact that I kept coming back with the same symptoms plus newer ones. You'd think
Yeah.
that the doctors would say, okay, something's going on, but
Yeah. I just
um,
went through this, Jen. Like 2 years ago was going in regularly. I was in the ER probably every 3 weeks for 2 months. And they were like, nothing's wrong, nothing's wrong. I'm like, why am I here then? Like,
yeah,
I have a crazy high pain tolerance. Tell me nothing's wrong. And then they ended up doing an ultrasound. They're like, oh, you have two gallstones the size of like golf balls. I was like, so like, where the hell was everybody for the last 2 months when I was in here crying in pain and you were telling me just go home?
yeah,
Like, why why are we not being heard? Why are we not being heard? That's my question.
yeah, exactly. And when I think back, like my husband and I were thinking back, about going to the ER all these times, and just getting sicker and sicker and sicker. And we realized, I said to him, "Do you know what? If I hadn't have gone to that appointment on the Friday afternoon with my doctor, I could have been dead
Yeah.
in my bed, um, you might have woken up to a corpse
Yeah.
because
Yeah, I was same with
that's,
my pulmonary embolism. If we hadn't turned around and gone right back, I would have suffocated to death. That's what was happening. I was suffocating,
yeah,
right?
yeah.
They,
So it makes me wonder how many patients have either died
yeah.
or their illness has gotten beyond control simply because doctors weren't listening to them, weren't hearing them.
Well, yeah. And I mean, I think it's a symptom of a larger problem, right? We're not, especially here in Canada, I'm grateful. I have to say, I'm grateful beyond grateful that healthcare is paid for the most part
Yes.
here. I cannot say enough good things about that. That being said, we are in a very reactionary space in healthcare in Canada. And so as a result, if people aren't literally dying when they walk in the door, it's like, it's probably nothing. And you really have to advocate for yourself. You have to be front and center and push, push, push and be like, nope, this isn't right. And, I'm learning that the older I get and the more misunderstandings I have with healthcare. um, and I mean, it's funny too, because, when you said, they brought up your mental health issues and whatever else. My mother ran the detox when I was a kid. So I was very well versed in addictions and that entire world. And it wasn't until I was in my late 20s that I would walk into a place and be like, no, here's what I'm here for. And I can't take any of these drugs. So this is not what I like. They would keep me for 8 hours with back pain because they thought I was trying to scam them out of drugs. And I had to learn to advocate the other way. I don't want any drugs. I'm not here for drugs. I don't want any drugs. Don't prescribe me anything. I'm here because of the pain. Can you please investigate this pain?
Yeah.
And I
Yeah.
had to learn to have that conversation through our medical system. And look, I get it. I get that people are out there trying to scam people for drugs. I appreciate that. However, nobody wants to sit for 9 hours in an emergency room. Nobody.
Doesn't matter how good those drugs are.
No, that's
I'm not
awful.
sitting there for 9 hours.
No, you can buy
Yeah.
that shit on the street. Why are they sitting in an emergency room for 9 hours? Like they
Yeah.
aren't. And so I think as much as that training has happened for healthcare professionals, where it's like, be aware of that, not like, can we also maybe be aware that 95% of the people coming in the door are not those people,
Yeah. Yeah.
right?
Well, especially, in Canada when you're sitting in the ER for who knows how long.
Yeah.
Nobody, anybody I know only goes to the ER if they're dying or if they're, on
Yeah.
fire or something, because it's just a drag.
It's awful. You're there
Yeah.
forever, right?
Yeah. Especially during COVID. Oh,
Oh, and I went twice, 3 times, 4 times, 4 times during COVID with my gallstones, and they were all
oh
like,
man.
"Oh, you're fine, go home." I was like, "I don't." And once they figured it out, they're like, yeah, we're gonna get you in for surgery in the next 6 weeks." I'm like, "No shit. Like, I can't function, I can't eat. This is awful." I lost like 30 pounds in 2 months because I was just like, I couldn't eat anything. Like
Jeez.
nothing. And I'm like, this all could have been resolved a lot faster if when I
Oh,
came
yes.
in the first time, it was like, yes, obviously. But I feel like it's almost like, when you call into Rogers and you're like, my bill's too high, and they're like, there's nothing we can do. And you have to push and push and push. And they're like, okay, we'll knock 40 bucks off a month. It's the same thing with the healthcare system here for some reason. You got to go in and they're like, no, it's fine. Don't worry about it. And you got to be like, actually, no. And if you come back a second time, they start to take you seriously. Like, how many people, like you said, between that first visit and that second visit didn't make it to the second visit?
Yeah. Well, I can tell you, if you were a man, you would have
Oh,
gotten
yeah.
in there a lot faster.
Oh, yeah. I laugh all the time because my husband will be like, I don't know, there's this weird thing with my hand. It's really weird. I told the doctor she's sending me for x-rays. And I'm like, excuse me? He's like, what? And I'm like, she's sending you for x-rays? He's like, yeah. I'm like, oh, must be fucking nice. I will go in and tell her my whole body is disintegrating from the inside out, and they'll be like, oh, maybe you need more sleep.
Got to lose a little weight,
Got to lose a little weight.
for sure.
Unbelievable. Like, and it's frustrating, right? I think that's frustrating for a lot of people. You and I can't be the only people who have experienced this.
Oh no, no. It happens to women all over the country, all over the world,
Yeah.
really.
And how many of us are putting up with, especially, super type A women, right? Like, we're busy, we're busy. I don't have time to be sick. I don't have time to go to the hospital. I'm not going to make that appointment. It's not a big deal. We don't recognize our own symptoms. And then it has to get dire before we actually do anything about it.
Yeah,
And then we go in and they're like, oh, it's nothing. It's not nothing.
yeah. It was nothing like several weeks ago. Today, it's really something.
Today it's something,
Yeah,
or I wouldn't be here,
yeah, yeah.
right? Like, this is
There's
the
something
challenge.
about it's the authority. It all stems from, it's all historical. It was historically men who were, doctors,
Yeah.
and the attitude towards women, and hysteria and all that sort of stuff, and it's slowly changing
It is
as
slowly
we get
changing.
diversity in the medical field, but
I
that
still see that
sort of,
misogyny through female doctors all the
yes,
time,
yeah,
like constantly. And it's funny, like when I was living in Toronto, um, they had done some blood work or something, and he was like, oh, your cholesterol's on the high side of normal. We're going to put you on this statin. And I said, well, I'm going to stop you right there. I have a lot of side effects to medication, so I would rather not take any medications unless I absolutely have to. And he's like, wow, this could save your life, so I really think you should highly consider it. I was on it for 2 weeks, and it actually, I don't read the side effects because I feel like I'm going to psychosomatically give them to myself. So I told my husband, like, you read it. And if I have any of these symptoms and I complain about them, can you kind of keep an ear? He was like, yeah, sure, no problem. So I'm like, I'm having a lot of weakness in my hands. It's really weird. Like, I can't open doorknobs or open lids off jars or twist anything. I can't. And then I started to not be able to use my hands at all. I couldn't write. I couldn't pick up my phone. I couldn't, out of nowhere. And I was like, I'm gonna stop taking that medication. And I had told Rick about it, and he went through and he was like, yeah, actually, so muscle paralysis is one of the side effects of that medication. And I was like, wow, okay, that's terrifying. I need to stop taking that immediately. And when I told him about it, he was like, oh, weird. Yeah, I've never heard anybody report on that. And I'm like, really? Because it is in the side effects. And he was like, yeah, no. And I was like, but remember when I told you I get all the side effects? And so
yeah,
you're telling me no one's ever reported on it, but it happens to be listed. So I don't like that, doesn't even make sense to me. So obviously people have, right?
yeah,
Reported that this is a
yeah,
side effect. He just wasn't hearing me or believing me, whatever it might be, when I said, no, listen, I'm highly sensitive to medications. And I've gone through the same thing in the last couple years with migraine meds. I just can't take any of them. None of them work for me. I get all the side effects.
mm, that's got
So,
to be bloody frustrating.
oh, it's infuriating. Honestly, like the last one actually gave me a full bout of vertigo, which lasted 2.5 months. And I actually couldn't leave my couch for 3 weeks when I first hit. I didn't know where it came from. And I can't see it being anything other than the migraine med that they had me on. So,
Yeah, I mean, well, I mean, if it just came out of the blue like that and then it disappeared after you stopped taking the med,
so
pretty much
weird,
tells you, yeah,
right? So
yeah,
weird. And so, like, it's like you have to constantly advocate for yourself in the system. And even then,
yeah. Do you know there's a saying in the disability community that disability is a full-time job,
yeah,
because
I can appreciate that.
you do spend a lot of time working on advocating for yourself, having your needs met, getting equipment, calling people, filling out paperwork, all
Yep.
that sort of stuff to get, Yeah, you do spend an awful lot. As a disabled person, I spend an awful lot more time on my disability
Yeah.
than, yeah, than I did well, I wasn't disabled before, but yeah, it's a lot of work sometimes
Yeah, I can
to
imagine.
advocate for yourself
Yeah.
and to, get all the equipments and medications and going to the appointments and all that sort of stuff. It is
And
quite a
just
bit of
getting
work.
around. Like I see your posts all the time. What's the name of your Facebook group? Because it's so
Oh, a day in the life of a PWD, a person with a disability.
yeah, I love your posts on that page. I think they're really insightful and you're a great writer. And it's just so nice to like hear that perspective. Like I'll see you take a picture and be like, "So I just got left like for the third bus and I'm so incensed at this point. I'm like ready to lose it." And I'm like, "No kidding. No kidding." Like as if it isn't hard enough to try and get yourself from point A to point B when you're not able-bodied, right?
Yeah,
But then to have to deal with the frustration of just the system that's put in place not working.
yeah,
That's
yeah.
infuriating.
Yeah, and I think it's also, I mean, after a decade of this, I can have a bit of a sense of humor about it now. Like I don't get as pissed off and full of angst
Sure.
because I'm accustomed to it. And I realized that I realized many years ago that if I got pissed off and angry and it ruined my day every time I encountered an accessibility issue, I'd be pissed off and angry all the time,
All the
right?
time. Yep.
So yeah, I mean, I had to decide how I was going to handle this. Um, and so I just decided, okay, I'm just going to roll with the punches. This is going to happen regularly in my life. But the side that really does get me worked up is how people sometimes treat me.
Right.
And I went through this really interesting phase when going from eight, because up until I was 38 years old, I was non-disabled. My body worked just like every other average female body.
Yeah.
And that's the body I trained in for theater. When I came out of the hospital and I integrated back into the community, I was really shocked at how differently the average Joe on the street would treat me. I'm the same person.
Yeah.
I wasn't impacted cognitively, so I still have the same brain, still the same function that I used to. I still think the same way. Um, I still have the same passions and interests,
Yeah.
and yet people treat me very differently when they see my wheelchair or the body that I'm in.
Yeah.
And for a long time, that really impacted me.
Sure.
And a bit of a blow to my confidence. And there was internal, like, it made me really angry because
Yeah,
I
I can
felt like
imagine.
saying, like, I didn't suddenly become stupid or infantile when I came out of the hospital just because
Yeah.
I'm in a chair. But over the years, I've also, the other thing too is what's funny is I am now covered in tattoos. I've got tattoos all over my arms. So, but when I first came out of the hospital, I wasn't tattooed. Most of my tattoos I got after I was disabled.
Yeah.
And I've noticed that since being tattooed, people now treat me even differently. So, like at
That's
first,
interesting.
I guess it's the tattoos. People must think, oh well, I'm guessing they either think I have a history or
Oh, but you are one of the most badass humans I have ever met in my lifetime. Like you have the life of like epic proportion. The stuff that you've lived through, honestly, you're a badass. This is the truth.
Yeah, I mean, I started out in teenagehood. That was the start. I mean, you name it, I've done it. And it's funny when I when I think back on it, I'm like, I don't even recognize that person anymore. Like
Yeah.
I got was ran away from home. I got involved in drugs and alcohol. I became a drug dealer. I was a prostitute for a while. I mean, I was in prison
Yeah.
all in my teenage years.
Yeah. Thank you for joining us for Jennifer Burgmann Part 1. And it is only going to get more interesting, folks. Jennifer is so fascinating and she has such an incredible story to tell. I really hope you join us for Part 2. Thank you for listening. Like and subscribe to our channel wherever you listen to podcasts. Visit www.yorkmotivational.com for more information on my Super Type A attempt at being Zen, the coaching program, Lead Without Permission, or visit our contact page to reach out to Risha. Wishing you all continued balance and fulfillment on your road to Zen.